At the prestigious Stockholm Neurology Conference, everyone had watched Dr. James Parker's magnificent brain surgery technique with admiration. When he turned to the simply dressed woman who spoke up during the Q&A session, a condescending smile spread across his face. "Don't worry, I'll try to simplify the topic for you," he said mockingly. Everyone in the hall shifted uncomfortably. No one dared to tell him who this woman was. The magnificent Karolinska Institute in Stockholm was one of the most respected centers in the medical world. This prestigious institution, where the Nobel Prize in medicine is awarded, symbolized scientific excellence with its more than 200 years of history. The largest conference hall in this historic building offered splendor befitting scientists with its elegant wooden panels, crystal chandeliers, and leather seats. Every year it was filled with distinguished neurologists and brain surgeons from all over the world. Today, on the third day of the International Neurology Conference, the hall was more crowded than usual, because according to the program, the rising star of neurosurgery, Dr. James Parker, would be introducing his new brain tumor surgery method called the Parker technique. Dr. James Parker, 52, was a professor at Harvard Medical School and head of neurosurgery at Boston, Massachusetts General Hospital. Tall, athletic, with an angular jawline and sharp blue eyes, he looked like a typical Hollywood heartthrob. A graduate of England's prestigious Oxford University, he had risen rapidly in his career. The minimally invasive surgical techniques he had developed over the past 5 years had enabled the successful removal of hard-to-reach brain tumors and had earned him international fame. His articles were frequently published in neurosurgery journals, and he regularly appeared as an invited speaker at conferences. Besides his academic achievements, he was also known for his charismatic personality and media presence. He graced the covers of medical magazines and frequently appeared on television programs. People magazine had once included him in their list of world's sexiest doctors. Although Parker had declined this title, it was rumored that he secretly took pride in it. Parker's only problem was his growing ego and increasing arrogance that came with his success. Among his colleagues, he had begun to be referred to as having a God complex, a common condition in the world of neurosurgery. He could be ruthless towards those who criticized him, and young doctors were especially afraid of making mistakes in front of him. At the hospital in Boston, being on Parker's surgical team was both an honor and a source of stress. Rumors circulated that he had once expelled an assistant from the operating room for a small mistake and ruined their career. In the front rows of the conference hall sat young doctors from Dr. Parker's team and his admirers, a select group with dark suits, pearl necklaces, and designer frame glasses. In the middle rows were colleagues from various universities and hospitals. In the back rows were medical students and conference participants. In one of the back rows, a simply dressed woman sat quietly. Dr. Sarah Chen, 42, was a medium-height, slender Chinese-American woman. She wore a dark, simple pantsuit and had her black hair tied back. For jewelry, she wore only a thin gold necklace and a pair of small earrings. She wasn't flashy in any way. There was no makeup on her face, but her intelligent eyes and calm, thoughtful expression gave her a natural elegance. She was taking organized notes in her notebook, carefully watching the presentation. Next to her sat a young assistant, Dr. May Wong. "Professor," May whispered, "why aren't you sitting in the front rows? There should have been a reserved seat for you." Chen smiled. "I can watch more comfortably from here, May. Besides, I don't want to attract attention. Today, I'm just a listener." May couldn't understand her mentor. Dr. Chen was one of the most respected names in the world of neurosurgery, but she constantly avoided being in the spotlight. She always wanted her work, not herself, to be talked about. The hall lights dimmed slightly and the stage lit up. Conference chairman Dr. Erik Lindberg, a respected Swedish neurologist, took the stage to introduce Dr. Parker. "Today, we have the great honor of hosting one of the most innovative names in modern neurosurgery. Professor at Harvard Medical School, head of neurosurgery at Massachusetts General Hospital, recipient of countless awards, and creator of the Parker technique. Please welcome Dr. James Parker to the podium." The hall filled with applause. Dr. Parker took the stage in his perfectly tailored navy blue suit, matching tie, and shiny cufflinks. With his silver mixed hair and charismatic smile, He attracted admiring glances from some of the female doctors in the hall. "Thank you, Dr. Lindbergh, for this kind introduction," Parker began with his confident voice. "And of course, thank you for giving me the opportunity to speak at this prestigious conference. It is truly a privilege to be here in this beautiful city of Stockholm, coming together with the brightest minds in the medical world." For the next hour, Dr. Parker gave a fascinating presentation. He explained his new technique with detailed videos, 3D models, and case studies. He presented statistics showing less blood loss, faster recovery, and lower complication rates compared to traditional methods. The presentation was truly impressive, and most of the audience was mesmerized. In the back row, Dr. Chen continued to take notes carefully. Occasionally, she furrowed her brows, and sometimes she smiled slightly. Parker's approach was truly innovative, but Chen had also identified some potential problems. "And thus," said Parker, approaching the end of his presentation, "the Parker technique makes it possible to intervene in tumors previously thought to be inaccessible with minimal side effects. In the 87 cases we have performed over the last 3 years, our success rate is over 94%. This means a 23% improvement compared to traditional approaches." With a proud smile, he added, "Before moving on to the Q&A session, I have one last thing to say. This technique was developed as a result of 5 years of dedicated work by our team at Harvard. Of course, I led, but I also appreciate the contributions of my young colleagues, especially the efforts of Dr. Roberts and Dr. Sharma were instrumental in achieving these results." This show of humility was actually a false modesty. Everyone knew that the technique was almost entirely Parker's own work, and he knew it too. Roberts and Sharma were Parker's closest assistants, and their contribution was limited. "Now I'm open to your questions," he said, taking a sip from the water glass at the podium. Several hands went up. Parker pointed to familiar colleagues in the front rows. The questions were generally complimentary, asking for clarification on some details of the technique or referencing Parker's other work. He answered each question confidently and in a way that garnered approval. "Dr. Parker, what do you think about the applicability of this technique in pediatric patients?" asked a neurologist in the front row. "Excellent question," said Parker. "Our technique has been successfully applied in pediatric cases as well. In fact, in collaboration with Boston Children's Hospital, we are working on a version specifically adapted for children. The initial results are very promising." "About 10 minutes later, I can take one more question," he said, looking at his watch. "After that, we need to move on to the next session." A delicate hand raised from the back rows. Dr. Sarah Chen's hand. Parker usually preferred important people in the front rows, but no more hands were raised. Reluctantly, he said, "Yes, the lady in the back row." Dr. Chen stood up. There was a tone of respect and curiosity in her voice. "Dr. Parker, your technique is truly impressive. Especially the navigation system you developed for deep tumors is very innovative. However, I'm wondering, when approaching tumors near the anterior cerebral artery, how do you manage the potential risk of ischemia in the adjacent tissue?" The question was quite technical and addressed one of the most sensitive points of the surgical technique. The anterior cerebral artery was a critical vessel supplying the front part of the brain, and any intervention in this area could jeopardize blood flow. It was a topic Parker had glossed over in his presentation. Experienced surgeons in the hall immediately recognized how pertinent the question was. This was a potential weak point of the technique. The expression on Parker's face changed. His eyebrows furrowed slightly. His eyes examined the woman asking the question more carefully. Her modest attire, unassuming appearance made him think she might be an assistant doctor or medical student. Why was she questioning the most difficult aspect of his technique? A condescending smile spread across his face. "Don't worry, I'll try to simplify the topic for you," he said mockingly. "The anterior cerebral artery is an important blood vessel that supplies the front part of the brain. Protecting this vessel during surgical intervention is one of the basic principles of neurosurgery." Everyone in the hall shifted uncomfortably. Parker was implying the questioner's ignorance by explaining basic anatomical information. Some doctors in the front rows exchanged worried glances. No one dared to tell him who this woman was. Dr. Chen responded calmly, "Yes, doctor. Parker, I'm familiar with arterial anatomy. My question was about the potential effect of your technique on collateral circulation in this region. I'm particularly curious about how blood flow in perforator vessels is preserved. Parker's smile became a bit strained. It was clear that the person asking the question had an understanding beyond basic anatomical knowledge. Of course, I see you have some basic knowledge. Our technique uses microdissectors specifically designed to protect microvascular circulation. This minimizes any risk of ischemia. The answer was general and didn't really address the specific question. Chen noticed this but just nodded and sat down. Parker, with a sense of relief, said, "If there are no more questions, let's end here. Thank you all again for your attendance." Conference Chairman Dr. Lindberg took the stage again. "Let's thank Dr. Parker once more for this enlightening presentation. We'll now take a 15-minute break, after which our conference's keynote speaker, Dr. Sarah Chen, will give her presentation titled Recent Developments in Neurovascular Microsurgery." The expression on Parker's face froze. Sarah Chen, the editor-in-chief of the world's most respected neurosurgery journal, the director of the Tokyo International Brain Surgery Center, and a nominee for the Nobel Prize in Medicine for the last 3 years, Dr. Sarah Chen. The simply dressed, not at all impressive woman sitting in the back row of the hall, was that Dr. Sarah Chen? As Dr. Chen modestly gathered her notes, the hall filled with applause again. This time the applause was more enthusiastic. As Parker descended from the podium, he had to pass by Chen. Their eyes met. There was no trace of arrogance on Chen's face, just a slight, professional smile. "Impressive technique, Doctor," Parker said Chen with genuine professional courtesy. "Perhaps I can suggest some alternative approaches after the break." Parker could only nod. His throat had gone dry. He had just belittled a world-renowned authority and now realized that the shortcomings of his own presentation would be addressed by her. During the break, whispers circulated in the corridors of the conference hall. Everyone was talking about Parker's gaffe. A young doctor asked his colleague, how did he not realize the woman was Chen? Didn't he recognize her? "Chen stays away from the media," replied the other. "She doesn't like being in front of cameras like Parker does. She focuses only on her work. Her publications and surgeries speak for her. Most young doctors wouldn't even recognize her if they saw her." Another doctor added, "Did you hear last year she removed a tumor thought to be impossible, a deep-seated brainstem glioblastoma. The patient is now completely healthy. Chen never published this, but the case has become a legend in medical literature." Parker had retreated to a quiet corner of the conference building, quickly searching for information about Dr. Chen on his phone. What he saw concerned him even more. Sarah Chen was one of the most innovative brain surgeons of the last decade. She had groundbreaking work particularly in the field of neurovascular microsurgery. Some of the approaches on which Parker's new technique was based had actually been first proposed by Chen, but Parker had not made any reference to her in his presentation. Moreover, Chen's latest paper proposed a new approach to tumors near the anterior cerebral artery, precisely the weak point of Parker's technique. Chen had already identified the potential risks of Parker's approach and developed a safer alternative. Parker looked at Chen's photos on his phone. There were a few professional photos taken at conferences, a few group photos. In all of them, she was the same simply dressed, unassuming woman, but the intelligence and peace in her eyes would not escape the notice of a careful observer. As Parker was sweating cold, the hall bell announced the end of the break. He had to return, perhaps to experience the most embarrassing moment of his career. When he entered the hall, all seats were filled. No one wanted to miss Dr. Sarah Chen's presentation. Parker sat in the reserved seat for him in the front row, right across from the podium. There was no escape. Dr. Lindberg introduced Chen again, this time detailing her impressive resume. Her education at Harvard, Johns Hopkins, and Tokyo, 6 surgical techniques she had developed, 118 groundbreaking scientific papers in the field of neurology, the international research team she directed, thousands of life-saving surgeries. Especially her pioneering work in neurovascular surgery had enabled the treatment of cases previously considered inoperable. The hall applauded more enthusiastically with each achievement mentioned. Dr. Sarah Chen took the podium with the same modest demeanor. Her unassuming appearance hadn't changed, but now everyone in the hall was aware of her greatness, including Parker. "Thank you, Doctor. Lindbergh, Chen began with a calm and confident voice. And thank you, esteemed colleagues, for being here today. Science advances through collaboration and knowledge sharing. We all serve the same purpose, improving the lives of our patients. Chen's presentation was extraordinary from beginning to end. Without looking at any notes, she explained complex neurosurgical concepts with both clarity and depth. She presented technical details in a way that even the most experienced surgeons could learn from, but at the same time explained the topic in a way that students could understand. She was an excellent educator. While showing a video of a deep white matter tumor, she said, "In this case, traditional approaches would fail. The tumor is very close to critical functional areas. However, thanks to the new navigation system we've developed, we can work with millimetric precision." Midway through her presentation, "Now let's come to our approach to deep tumors near the anterior cerebral artery," she said. "This is one of the most challenging areas of neurosurgery." Parker tensed in his seat. Chen was looking directly at him. "The technique that Dr. Parker described this morning is an important advance in this field," Chen continued with professional respect. "His minimally invasive approach provides excellent results for many cases." Parker relaxed a bit. Perhaps Chen wouldn't criticize him directly. "However," Chen continued, "like any surgical technique, this one also has some limitations. In particular, we need to be careful about its potential effects on arterial circulation." Chen then gently but definitively addressed the weak points in Parker's technique. She showed that in tumors near the anterior cerebral artery and its perforator branches, Parker's approach could increase the risk of ischemia. She demonstrated her own, safer alternative approach. This approach better protected microvascular circulation while removing the tumor. She supported it with statistics, 3D models, and case studies, all presented with scientific objectivity without personal attack. But for Parker, each word was like a needle. Chen wasn't tearing down his technique. Worse, she was complementing and improving it. She was doing what Parker couldn't do. Towards the end of the presentation, Chen mentioned a new imaging technology they had developed in her laboratory in Japan. This technology could visualize blood flow in brain tissue in real time during surgery. "This way," said Chen, "the surgeon can immediately see the effects of the intervention on the vascular system and adjust their strategy if necessary." When it came to the Q&A session, Parker was the first to raise his hand. He had to do this. If he didn't, it would be seen as cowardice. "Dr. Chen," he said, trying to keep his voice as steady as possible, "your approach is very interesting. However, don't you think that the modification you suggest might extend the operation time? You know, long anesthesia durations carry their own risks." Chen smiled. "Excellent question, Doctor." Parker: "Initially, I had the same concern. However, thanks to the rapid navigation system we've developed, operation time is actually reduced by 12%. Our technique, despite being more precise, is paradoxically faster. If you'd like, I can show you the specific data after the break." Parker could only nod. Chen had offered him a way out, and he would take it. After the presentation, while a group of young doctors surrounded Dr. Chen, Parker quietly approached. He waited outside the group. Then when he got the opportunity, he approached Chen. "Dr. Chen," he said with genuine humility in his voice now, "thank you for your presentation, and I apologize for the earlier misunderstanding." Chen looked at him with neither cruel triumph nor condescension in her eyes. Just professional understanding. "Your apology is accepted, Doctor." Parker: "We all sometimes make snap judgments." "I should have been aware of your technique earlier," Parker admitted. "I apologize for not thoroughly reviewing the literature." "Science is for advancement, Doctor." Parker: "Not for competing with each other," said Chen. "Perhaps by combining our techniques, we can achieve even better results." "Would you consider a collaboration between Harvard and Tokyo?" Parker was surprised. Was Chen suggesting a collaboration to him, even after he had belittled her because of his arrogance? That would be wonderful," he said with genuine gratitude. "Good," said Chen, extending her business card. "Call me when you come to Tokyo. I would be delighted to show you my laboratory and team." As Parker took Chen's card, Dr. Lindbergh approached them. "Ah, I see the two geniuses have already met," said the Swedish doctor. "Actually, I have an idea. I'd like to invite you both on stage for the closing panel of the conference. It will be a discussion on the future of neurosurgery. Two different perspectives, two different approaches. What do you say? Parker's instinct was to object. Wouldn't sharing the stage with Chen highlight his own inadequacy even more? But he had no other option to preserve his professional reputation. I would be honored, he said with a forced smile. So would I, said Chen. The coming together of different perspectives is always good. That evening at the conference gala dinner, Dr. James Parker and Dr. Sarah Chen sat at the same table. Other surgeons had initially been concerned that the situation would be awkward, but they relaxed when they saw a friendly professional discussion developing between the two. I see, Parker was saying, grasping a point. So the key in your microvascular anastomosis technique is to do the exact opposite of the traditional approach? To slightly loosen the vessel instead of stretching it? Exactly, Chen confirmed. Sometimes the best solution is to look at the problem from a completely different angle. In brain surgery, we are usually very careful and therefore very tense about vessels. This caution is important, but sometimes this tension is exactly what leads to complications. Parker nodded thoughtfully. You've taught me a valuable lesson today, Doctor. Chen, not just about surgery. Chen smiled. We all learn something every day, Doctor. Parker, I've learned many things from your technique as well. Especially your approach to deep white matter tumors is truly innovative. Parker was surprised. Had Chen really learned something from his technique? Was this just a kind lie to make him feel better? Really? Of course, said Chen with genuine sincerity. None of us can know everything. Every surgery, every technique, every approach teaches us something new. Continuing to learn throughout one's career is the most important characteristic of a good surgeon. I seem to have forgotten that, Parker admitted. In recent years, I've focused more on teaching and being an expert. Perhaps I forgot to remain a student. Chen nodded. This can be a trap for all of us. As success comes, it's easy to lose humility. While other doctors at the table were listening to the dialogue of these two brain surgery giants, a young surgical assistant, Dr. Mei Wang, gathered courage and spoke. Doctor, Parker, Dr. Chen always tells us, our greatest teachers are our patients. Is there a patient you can't forget? Parker thought for a moment. Yes, a young woman named Clara. 5 years ago, she had a deep brain tumor. All other surgeons had said it was inoperable. I nearly agreed, but that determination in her eyes, it made me push myself. That surgery formed the basis of what is now known as the Parker technique. And how is Clara now? Asked Chen. A proud smile appeared on Parker's face. Excellent. She became a mother of two, runs marathons, and lives her life to the fullest. That's why we do this job, said Chen, raising her glass. For our patients. For our patients, everyone repeated. As Parker and Chen said goodbye outside the conference center after the gala, Parker gathered courage to ask a question. Dr. Chen, I wonder, this morning during my presentation, were you bothered by my behavior when you asked your question? Chen thought for a moment. I wasn't bothered, Doctor. Parker, there is always questioning and testing in scientific environments, but perhaps this could be an opportunity for reflection for you. How so? Science is not just about what we know, but how we know it, said Chen. A person's outward appearance, titles, or connections don't determine the value of their knowledge. Sometimes the most valuable insights come from the most unexpected sources. Parker nodded. You're right. I guess as my success increased, I built walls around myself. I started listening only to ideas from certain circles, certain people. We all do this, Chen said understandingly. Scientific blindness is a danger not just for one person, but for the entire scientific community. That's why different voices, different perspectives are so important. A few months later, the medical world witnessed the announcement of a new surgical approach known as the Parker-Chen protocol. This protocol combined Dr. Parker's minimally invasive technique with Dr. Chen's neurovascular protection approach. Initial results were promising: lower complication rates, shorter recovery times, and higher success rates. In the joint paper introducing the protocol, the two surgeons wrote, This collaboration is the result of two surgeons from different schools, different approaches coming together for a common purpose. Scientific progress is achieved not only through new discoveries, but also by bringing together different perspectives. Among the authors of the paper, the names of Dr. Parker and Dr. Chen were side by side, neither preceding the other. This was a rare show of humility in the world of neurosurgery. 6 months later, Parker visited Chen's laboratory in Tokyo. The laboratory was filled with state-of-the-art equipment, but it also had a surprisingly warm and inviting atmosphere. Surgeons, scientists, and technicians worked together without a sense of hierarchy. Chen addressed all team members by their first names and encouraged them to express their ideas openly. "Your work culture here is very different," said Parker while touring the laboratory. "In Boston, my department is more hierarchical." Chen smiled. "Each approach has its own strengths, but I have always believed that the best ideas emerge when people feel safe and valued." "I'm afraid I've been advocating the opposite for a long time," Parker admitted. "I thought pressure and competition brought excellence. Perhaps this is another area where we can combine the strengths of both your approach and mine," said Chen. That evening, Chen hosted Parker at her home. It was a modest but tastefully furnished apartment. On the walls hung artwork and thank you notes made by Chen's patients. One of them particularly caught Parker's attention, a colorful picture made by a young girl depicting Chen as an angel. "Aiko," said Chen, pointing to the picture. 8 years old, she had a complex brainstem tumor. 6 doctors had said it was inoperable, but we tried and succeeded. She's now 14 and plays violin in the school orchestra." As Parker looked at the picture, his eyes welled up. "You know, you're recognized as the world's best brain surgeon. Dozens of awards, hundreds of papers. But what matters most to you is this, isn't it? Your patients?" Chen nodded. "Awards come and go, Doctor Parker. Papers gather dust on library shelves. But changing a life, that lasts forever." That night, Parker thought for a long time. He reevaluated what he had been pursuing throughout his career. Fame, prestige, recognition. Were these really important? Or was the real purpose, as Chen said, to provide the best care to patients and change lives? When Dr. James Parker returned to Boston, he began making changes in his department. He no longer belittled his assistants, instead supporting them and encouraging them to express their ideas. In the operating room, he treated team members with more respect. He was even seen patiently answering a very young surgical assistant's question about his technique. In the past, he would have expelled this assistant from the operating room. In his classes at Harvard Medical School, he now told his students, "One of the greatest virtues in medicine is humility, because no matter how much you know, there is always someone you can learn from." That was the most valuable lesson I learned from Dr. Sarah Chen. A year later, the Parker-Chen protocol gained worldwide acceptance and became standard teaching material in brain surgery programs. The two surgeons wrote a book together and organized training programs in various countries. As a result of their collaboration, many tumors previously considered inoperable could now be successfully treated. At the Stockholm Neurology Conference's session 2 years later, Dr. Parker and Dr. Chen took the stage together. The hall was more crowded than ever. This time, Chen wore an elegant suit, still modest but more elegant. Parker, on the other hand, had chosen a more comfortable outfit instead of his usual formal suit. "Esteemed colleagues," Parker began, "today we are here to share not just a surgical technique, but also the power of scientific collaboration." 2 years ago in this hall, Dr. Chen and I had an unexpected encounter. That encounter was a valuable lesson for me, Chen smiled, and for me as well. Dr. Parker's technical excellence and innovation helped me improve my own approach. Together, they explained the details of their protocol, shared case studies, and during the Q&A session, they displayed perfect harmony, completing each other's sentences. At the end of the presentation, a young medical student spoke up. "Dr. Parker and Dr. Chen, what do you think is the most important characteristic of a good brain surgeon?" Parker and Chen looked at each other, as if thinking of the same answer. "Humility," said Parker. "And a constant desire to learn," Chen added. "But most importantly," Parker continued, "truly valuing people, your patients, your team members, your colleagues. Medicine, at its core, is about people." Chen nodded in agreement. And sometimes the most valuable lessons come from the most unexpected sources. That's why listening to every voice, valuing every perspective, is the beginning of true wisdom. The hall applauded, standing for a long time. In the front row, Dr. Mei Wang looked proudly at her mentor, Chen. A few rows back, a group of young assistants whispered about Parker's new, more inclusive leadership style. And in the back rows, a modestly dressed, unassuming young female doctor was quietly taking notes. Perhaps the future Sarah Chen or James Parker. And perhaps the lessons learned in this hall today would shape not just the field of brain surgery, but the future of medical science. Because true wisdom lay not just in the accumulation of knowledge, but in how we use that knowledge and how we shared it with others. If you enjoyed our video, don't forget to subscribe and share your thoughts in the comments. Where do you think true wisdom lies? Have you ever experienced misjudging someone based on their appearance or being misjudged yourself? Where in the world are you watching from today? Share with us in the comments. Don't forget to subscribe to our channel for more stories of unexpected heroes.